Aliasing can be a difficult topic to understand on Doppler ultrasound, but I was trying to figure out a way to make it a little bit easier to understand. Aliasing is the inaccurate display of Doppler velocity when the velocity range exceeds the scale available to display it. And this is there's something called the Nyquist frequency, where if the Doppler frequency shift is greater than half the Doppler sampling rate or your pulse repetition frequency, then that's where aliasing occurs. It becomes difficult to understand where the velocity, the direction is actually going in. And so I thought of an easier way to kind of understand this. And this involves looking at a clock. When you have a clock, it takes about 60 minutes. Right, it takes 60 minutes for the clock to go completely all the way around. And so if you end up taking 15-minute naps, and you just look at the clock every 15 minutes, well, you'll see the 12, then you'll see the 3, then you'll see the 6, another 15-minute nap later, you'll see the 9, and then you wake up again after another 15-minute nap, and it goes to the 12. And so you're able to accurately depict, just based off of seeing that it went from the 12 to the 3 to the 6 to the 9 back to the 12 again, that the direction of the minute hand is actually going in the right direction. It's going clockwise. Now, if we meet it at half the frequency, so the frequency in which it goes around is 60 minutes, if we start taking 30-minute naps, which are at half the frequency, that's where things get a little confusing, because if we take a 30-minute nap, we go from the 12, and then we look at it and we see the 6, and then we look at it and we see the 12. And again, if we've never seen a clock before, we don't really have any understanding of the direction in which things are going. It doesn't look like it's moving in a particular direction. Now, if we go greater than half of the frequency of the clock, now we're going to go at 45-minute naps. Now we're going to be in a situation in which things get even more confusing, because if we take a 45-minute nap, it goes from the 12, then we wake up and you see it's at the 9. We take another 45-minute nap, it goes from the 9, 45 minutes later will take us to the 6, another 45 minutes later will take us to the 3, and then to the 12. And so you can see, if we're taking 45-minute naps and we've never seen a clock before, we think that the direction of the minute hand is actually going in the reverse direction. And so this is what happens when you get greater than half the frequency in which you're sampling things. It gets quite confusing as to which direction you're going in. Now, if we go at 60-minute naps, it looks again like nothing's really moving. So we have no understanding in which things are moving. If we go at 75 minutes and we look at it every 75 minutes, we can see that it actually then goes back to our regular interval of clockwise flow. And so what ends up happening is the lengthier your naps are, it goes from normal direction to no direction, to reverse direction, to no direction, and then normal direction again. And we can see this actually in a number of interesting examples. Here's one where the helicopter looks like the blades aren't moving, but all that's happening is that the camera, when it's taking those individual images together, the frequency in which it's taking those images is the same frequency in which the blades are moving around, and so it's not able to depict the actual direction of flow. Here's an example here where we're going to be looking at a wheel, and we're going to see that the wheel is actually going in one direction, and we'll see it slows down and then goes the reverse direction and then slows down and then goes the forward direction. This is very similar to the clock analogy here, in which things are just getting faster and faster, but because we're dealing with limitations of how fast the camera is taking pictures, therefore it can inaccurately display the direction in which the wheel is moving. So how do we see this on ultrasound? Well, here's an example here of a transplanted renal artery. We can see that the scale here, which is akin to our pulse repetition frequency, is from 40 centimeters per second going towards the probe to minus 40 centimeters per second going away from the probe. And if we just look at this, it looks quite confusing. It looks like this flow going towards the transplanted kidney here, then away from, and then towards, and then away from, and then towards. And that doesn't really happen physiologically. What's going on here is that these are two areas here where the the velocity here exceeds 40 centimeters per second. So because it doesn't know how to depict that, it's going to scale, it's going to wrap around to the bottom here, and it's going to make it look like it's a reversing in flow in these two areas here. And this is actually can be useful. This artifact can be useful in trying to figure out, well, where are the areas in an artery where you see increased velocity. Sometimes this Doppler artifact can be useful, and these particular areas are areas of higher velocity, which can indicate areas of stenosis. And here's our MRI, where you can see there are two areas of near complete occlusion of the renal artery, which correspond with the areas of the high velocity that we see here. Here's another example here. Here's our right ovary, and then we have an artery right underneath it. And we can see this very interesting shape of it. We're kind of seeing a cross-section of the artery here. And when we look at it, it looks like there's blue, and then it goes to red, and then it goes back to blue again. And all that's happening here is that in a vessel, the slowest flow is always going to be on the edge because it's interacting with the vessel wall. And then as you get more centrally, it's getting faster and faster. But because here we're up against the scale limits here, which is from here 5 centimeters to minus 5 centimeters, because it's going more than 5 centimeters per second at this particular point, it has to wrap around and go on the other side of the scale and make it look blue. And I just put this scale side by side. I put two of them side by side, and you can see how nicely this correlates with the image that we're seeing here. Now you can see aliasing on spectral Doppler as well. Here you see the incorrect depiction of the direction of flow is now below the baseline here. We can fix this in a few different ways. One of them is you can change the baseline setting on the spectral Doppler image. That's probably the easiest thing to do. But if we go up against those limits, then you can increase the velocity scale, which is you're increasing your pulse repetition frequency. You can also use a lower frequency ultrasound. And then finally, you can increase your angle of inclination to try to fix aliasing. So let's look at a few examples here. Here's one where you can see there's aliasing going on here. There's incorrect depiction of this direction of flow here. Here you can see the baseline is quite high, so all I did here was drop the baseline here, and it brings everything to the appropriate direction of flow. Here's another one here where you can see aliasing going on the left. How did we fix this in this case? Well, here we mostly changed our pulse repetition frequency. Here is 1.6. It went up to 2.6. What does that do? That increases our scale on our spectral window here. Here we're going from about 40 centimeters per second to about minus 20 centimeters per second. So there's about a 60 centimeter per second scale here, whereas here we're going from about 60 centimeters per second to about minus 20 centimeters per second, or maybe a little bit more than that. So this is probably around a 90 centimeters per second scale. So this it's a bigger scale, which allows us to be able to to better depict the true direction of flow on this one. And then finally, the other thing we can do is we can also change the frequency of the probe. We can drop the frequency to increase the scale. Here we can see the frequency is at 3.1. The scale here is about 0 to 300 centimeters per second. But if we change our frequency, drop it down to 1.7, we can see here that our scale is now moved up to about 1,000 centimeters per second, and it can better depict the actual velocity on this particular image. Vibration artifacts can be seen on color Doppler as well as spectral Doppler imaging, and it's usually seen when you have turbulent flow through a vessel that causes vibration in the surrounding tissues, and the vibration or the movement is picked up on the Doppler imaging. You can see this in arterial stenoses, you can see it in arterial venous fistulas and pseudoaneurysms, anything where the surrounding tissues are going to vibrate because of the turbulence produced by the abnormality, and it produces this kind of Doppler signal here. You can see it again on the color Doppler image here. You can see that there's true flow within some of the vessels, but there's an abnormal amount of actual color Doppler signal indicating that there's something abnormal going on. In this particular case, this patient had an arterial venous fistula that was causing that vibration artifact. Now, how does this look on spectral Doppler? Well, spectral Doppler, you can see it really well when you have a nice clear spectral window. And in here you have spectral narrowing here because you're right at an area of stenosis. And so you get this nice clear window underneath, but you can see these regularly spaced areas of low amplitude signal on the spectral Doppler window. This is consistent with the soft tissue vibration. So this is analogous to that soft tissue vibration that we see on the color Doppler image. This is what it looks like on the spectral Doppler image. Here's an example of wall filter. Now, wall filter in Doppler is a setting that removes low frequency signals that are caused by slow moving structures. And so those things can include vessel wall motion, tissue motion, cardiac or respiratory movement artifacts. And so this kind of a low amplitude signal is sometimes what you want to get rid of to clean it up. It acts like a high pass filter. It allows the high velocity signals to pass while eliminating those low velocity noise. So here's an example here where we ended up increasing the wall filter, and you can see that this kind of low flow state, this low flow noise is being eliminated, and as you're eliminating it, it's starting to get rid of signal that you actually want to be able to see. And so there's a kind of a sweet spot in which you increase your wall filter to the point that you're not getting that artifactual noise, but then you're also not eliminating true flow. Here's an example here of a resistive index that was done within the kidney, and you can see that the resistive index looks like it's really high here, but that's because the wall filter, which is this WF setting right here, was set too high and therefore was getting rid of real diastolic flow. And so when we ended up repeating the same image and decreasing our wall filter, you can see that that low velocity amplitude was now included and allowed us to get a more accurate resistive index. Here's an example on the left of a patient who had electronic interference, and you can see these regularly shaped horizontal lines both above and below the baseline that simulate flow. Electronic interference in spectral Doppler refers to non-physiologic, these repetitive artifacts that appear on the Doppler tracing that are unrelated to vascular flow. They can be caused by a number of things: infusion pumps, EKG monitors, cell phones, improper grounding of the ultrasound machine, faulty power connections, or interference from other hospital equipment. In this particular case, this is a patient who had a renal transplant and had a Doppler cuff that was placed around the donor renal artery to be able to assess for renal artery thrombosis, and in this case that was turned on at the same time that we were doing our own spectral Doppler image, and it caused this artifact. We ended up just turning off the machine to assess for the renal artery thrombosis temporarily to be able to give us this better image on the right. So this is an example of electronic interference. Blooming is one of the artifacts that we can see on color Doppler imaging, and this is where the signal from the color Doppler spills beyond the actual vessel walls. Here's a case here where you can see this right adnexal mass, and you can see what looks like quite a large vessel right here. But when we look at it on the B-flow mode, which is a non-Doppler image and actually shows the true size of the vessel, we can see here that that vessel is actually much narrower than is depicted on the color Doppler imaging. And so what causes this artifactual blooming of the size of the vessel? Well, one of the features can be from increased gain on the color Doppler image. It can also be from low wall filter setting. Another cause can be from the low pulse repetition frequency and poor lateral resolution of the transducer. So why does this matter? Well, it leads to an overestimation of the vessel diameter or mistaken flow in surrounding tissue, and it can obscure vessel boundaries or mimic pathologic flow. And so here's an example here of a color Doppler image where we're looking at the renal vein here. There was concern of renal vein thrombosis, and it looks like here there's no renal vein thrombosis, but we ended up getting a CT scan of that same area, and sure enough, you can see this non-occlusive renal vein thrombosis. And so the reason that we're getting this is because of blooming artifact. So blooming artifact is really important to note. It's one of the limitations of color Doppler imaging to be able to assess whether there's thrombus within the vessel. Ways that we can reduce it are lowering the color gain, optimizing the pulse repetition frequency, using appropriate wall filter settings, and then zooming in or using a higher frequency probe for a better resolution.